Hi, I'm Gareth. I'm a psychiatrist and medical director in the UK, and I'm making videos about open dialogue, the transparent and inclusive approach to mental health care. Last time I made a video about what happens within network meetings, and if you haven't had a chance to go back and see that yet, please do, because I'm going to reference it a fair bit in this video, because this time we're going to talk about why I think the network meetings work as well as they do. Now, this isn't meant as an exhaustive list of everything that a network meeting can do or every process that's within it, but I'm hoping it's going to give you some insights into what some of the power of the subtle shifts is. So let's have a look at why network meetings work so well. The first reason that I think the open dialogue network meetings work so well is about their intentional design. Every part of what happens within a network meeting doesn't happen by accident. It was developed up by the team in Tawny over many years when they worked closely with service users to get their feedback on what was really working well for them and what wasn't. One of the things that they were often focused on within that process was about trying to make them feel different. And they would call this the difference that makes the difference. So some of the things within there are intentionally odd to try and create the dynamics of something new happening within the network. So that could be things like the questions, what's the history of us meeting today? Or the reflections that happen in front of people. So let's look at the reflections a bit more closely to think about what's the difference that makes the difference there. When we think about a traditional healthcare consultation, an expert often has a one-to-one meeting with the person. The nature of such conversations, the directness of the communication, means one party is always in the position of response. Imagine if I was meeting you as your doctor and I turned to talk to you directly and said, I think you have schizophrenia. I think that you should take a medication I was thinking of. It's called risperidone. I think it will help. By me being so direct with you and talking to you, you're immediately in the position of response. You're thinking about what you want to say back to me. There is an inevitable natural resistance that happens within all of us as human beings when someone is directly talking at us. Let's now pivot to a reflection in front of someone, which is what we looked at last time when we were seeing what happens within these network meetings. Here we can see that Ella and Vic have been placed into a listening position. The conversation between Fiona and Gary is taking place in front of them. And in doing so, there's been the removal of the dynamic of the direct response that has allowed the building in of a little extra space for hearing what Fiona and Gary have to say. It allows them to hear what is being said, to play with it in their own minds, for more than the first response to be considered. It's a really good example of one of those intentional design elements that I was talking about that allows the staff to hold themselves in a different position and be in a different way with the people they're trying to support. As a healthcare leader, I can't be present in every contact that happens within my services. So I'm always interested in what can be built into the way that the staff work that can hold themselves in a different way. And it's one of the reasons I love open dialogue so much, because I've seen it time and again now that staff have a structure and a system to follow which allows them to be their very best every time. The next reason that I think these network meetings work so well is when we think about the principle of co-production. Now, I've been in mental health services for 20 years now, and I've heard it come up time and time again as something that we espouse as a great aspiration within care, is that we should be building services with the people who are in the receipt of them, doing co-production in everything that we do. Well, here is co-production intentionally built in to every contact that you would have with a service user and those important to them. We saw that in the reflection that we were just looking at, that actually by having the conversations in front of someone and then turning back to them for their response, we immediately have the opportunity to check in with them, of being validated that we were on the right track, to be corrected if we're not quite there yet, or for more information to be added if we haven't yet covered everything that we need to. It's inviting the service user and their network to be equal partners in the production of every care event. So it really is living the principle of co-production. The next reason that I think these network meetings work as well as they do is because they are paced by the person, not the system. By letting the person and their network set the pace and take their own time to find their own words, there's far more chance of them building understanding into what's happening. The building of understanding can't be forced. Indeed, it's counterproductive to do so. And ultimately, the aim for us as mental health professionals is to help someone come to a new understanding of their mental health. It's not for us as professionals to have some brilliant idea or insight and then impart it upon the other person, because that just automatically, naturally within human beings builds resistance. Anyone who's ever tried to work with teams to bring about transformation or change will know that insights that individuals or teams build for themselves, rather than having it imparted upon them by an expert who parachutes in briefly to tell them how it is, those kind of insights where they've built them for themselves are far more likely to stick and to feel useful, and ones that they'll run with. And so it is the same within working with families and networks and people with mental health problems, is that we need to do care at the pace of human. The next reason why I think these network meetings work as well as they do is because of the opportunity to build emotional connection. We specifically train ourselves within open dialogue to become attuned to what's happening within our own bodies, to notice what's happening with our own emotional reactions, and then we're given a space within those reflective elements of the meetings to be able to share some of that personal response that we're having to someone's story. And I think this is the secret behind that feedback that I've heard time and again from people that I've been working with over the years in this way, where they will say, "I felt heard for the first time in all my years of coming to services." And the emphasis there is on the felt part of it. Because feeling heard is not being on the receiving end of an act of listening. It's about an emotional connection that is built between people and that is felt within your own body. And by actually training our staff in how to express that more clearly, and to give them, in the intentional design of the meeting, to give them a space where that is shared, that's where we have the opportunity to connect. And that's where more trust is built. The emphasis that we place upon the social within these open dialogue network meetings is absolutely crucial part of why it's so successful. Right at the beginning of the process, we ask, who's important to you? And then we try and include those people within the meetings, and we give equal respect to their voices within the process. We make sure that if conversation and meaning building is happening within the network, that we give space for that to breathe. And we as facilitators within the approach, when we do our reflections, try to model good listening and high quality dialogue between us. Real healing in mental health care occurs in the social sphere. We shouldn't be, as professionals, trying to help people think that finding understanding happens through contact with us as professionals. It's helping them realise that actually they can build much more of that understanding with the people who are important to them, and have them around who are around them far more often than we ever are. We have a mantra within Open Dialogue, which is nothing about us without us. And the idea of that is that if there's anything that we need to say about somebody, we have to get it done and said in the meeting in front of them. That's what the reflective space is for. Now, there's some obvious caveats that apply around if immediate safety is compromised, that confidentiality can be breached in those specific circumstances, but the vast majority of the time, we do hold ourselves in that space of nothing about us without us. What I found over the years is that this is a really clever part of the intentional design that means that staff have to think about carefully what they're saying in front of somebody. Their language remains far more compassionate and respectful, less jargon and labels is used, because they're having to say it in front of that person and their family. And in doing so, yet again, more trust is built with the network. The final point that I want to make within this video is that I think the network meetings provide a fantastic model for continuous learning for mental health professionals. It's rare in my experience for professionals to have many, if any, opportunities to be observed or to observe others. Yet here we have within this way of working an opportunity to work in pairs with many different colleagues in different meetings and see how they work, get their feedback on how you're working, and you immediately getting the far more structured opportunities for developing your own practice. But more than that, you've done it in front of the service user and their family, and you're getting their immediate feedback on whether you're getting this right or not. So you're drawing them into being part of your continuous learning environment for your staff. And even more than that, the service user and their network have had the opportunity to witness the conversation, the learning that was taking place, and for them to learn from it too. So you've got multiple overlapping continuous learning cycles going on in every network meeting, which means that you're turbocharging everybody's practice development over time by holding themselves in this way of working. Ever since I've started to work this way, I've started to reflect on how dreadfully inefficient it is to try and have conversations to make meaning about somebody and what's going on for them away from them. Why would you lose the opportunity for the person to be part of that process? It feels like a wasted opportunity, a waste of time, when you're actually denying the person the chance to come with you as you build your own thinking and development alongside. But if you go away and do that learning somewhere else and then turn back up, you've made some conceptual leap in your own head, and then you just impart that upon the person. That feels like such a wasted opportunity for them to have been part of the process. As I said at the beginning, this is not meant as an exhaustive list of every reason why network meetings work as well as they do, but I do hope it's given you some of the insights into what I think are really crucial aspects and clever bits of design within this approach that could be useful, maybe even within your own practice right away. I hope you're finding the videos useful. If you are, please do subscribe to the channel. Please click like on the down below, and I do hope to see you next time. Thank you.